Hey guys, my name's Sam Marticke, and the study I'm looking at is going to analyze the impact of medical marijuana laws and its effect on hospitalization rates in different states. So, just a little bit of background. As of right now, 28 states have legalized medical marijuana. We've seen most of those come through ballot referendums and other types of citizen engaged voting methods. So this study is also going to look at opioids and how they are related to these laws, and if there's any impact between the passage of these laws and their implementation and a decrease or an increase in the use of opioids and their negative consequences. So we've seen a huge uptake in opioid overdose deaths in recent years, over 20,000 in 2015 actually. This is only counting opioids that are prescribed by people or technically are considered prescription medication. So things like heroin don't really count in this figure. If you were to add that in, it would be another 15,000 or so deaths in 2015 alone. So obviously it's a pretty big epidemic that we're seeing here. And there's a lot of literature so far that thinks that increased access to legal medical marijuana could actually provide a safer alternative for patients seeking pain relief because it can be used to treat the same types of chronic pain that historically opioids have been prescribed for. So specifically, we're looking at how the relationship of medical marijuana legislation and access can impact hospitalization rates. Opioid pain relievers are also very prevalent in medicine right now, but no studies have measured the impact of medical marijuana laws on their use. And so we're going to see how that can possibly help states lower the amount of people that are using opioid pain relievers in a way that they should not be. So the study itself was done by Yuan Shi, who's at the University of California in San Diego. It's called Medical Marijuana Policies and Hospitalizations Related to Marijuana and Opioid Pain Relievers. So it's going to be testing the impact of medical marijuana laws on hospitalizations because of marijuana. So essentially, it's going to look at different types of hospitalizations and if they were caused by marijuana and what leads people to come to hospitals because of marijuana use. And it's also going to be testing the relationship between medical marijuana laws and the prevalence of opioid pain relievers. So essentially, it's testing the same thing, but also with opiates. So just the rates right there. So the methods they used was the data they collected came from the annual state level hospitalization data from state inpatient databases. The authors thought this was a great way to look at it because it kind of controlled for a few variables of the type of hospital, the type of patient, as well as prevented any self-reporting biases that you would see in a normal survey that's done in hospital. And so mostly the data was thrown through a few regressions to see if there was a causal relationship between the variables. So if you look at the results here, this is the main table in the article, and you can see there's a 23% reduction of opioid dependence or abuse hospitalizations in states that have implemented medical marijuana policies. And this is a pretty big increase, a pretty big decrease in the amount of people that are going to hospitals for opioid-related issues. There actually isn't a statistically significant increase in medical marijuana dependence. There's a small increase, but as you can see by the confidence interval, you can't really rule that as a general cause of the increase in hospitalizations. There's also a 13% decrease in the opioid pain relief overdose hospitalizations for states that have medical marijuana policies implemented in them. So these are pretty big numbers. They're pretty important because you can see that there's a obvious statistically significant effect on the amount of people that are going to hospitals for reasons associated with opioid use, dependence, abuse, overdose, generally pretty bad things that you don't want to be experiencing. And so hopefully these medical marijuana laws are having a pretty positive effect on a lot of people. So they're able to conclude that medical marijuana laws have no impact on the number of hospitalizations for marijuana usage. They did say that marijuana usage itself, non medical of course, might actually go up, but the public health issues related to its consumption. So the typical things people worry about are people going to be driving high? Are they going to be doing other things they shouldn't be? Are they going to be overdosing on these substances? That they did not find a statistically significant amount. And the impact of medical marijuana laws on opioid-related health issues was correlated at a high enough level to suggest a causal relationship. So this seems that states could look at medical marijuana laws as a way to slow the increase in opioid-related overdose deaths. This study has a lot of great implications, and hopefully we'll see in the future that states will be using these policies as a way to curb the large increase in opioid overdoses and generally bad effects. we've been seeing recently.